Hey friends, it is Monday night and it's 7:30, so it's about a little live. So what I want to talk to you about today is actually something really deeply personal as well as professional for me. It's about being your own health advocate. So in my 27 years as a registered nurse, I've stood beside patients, families, students, fellow nurses, other healthcare providers, helping them navigate really tough healthcare decisions. Advocacy has always been at the heart of my work, whether in the hospital setting or now in my holistic practice. I believe everybody deserves informed, respectful, and compassionate care. And that includes being empowered to ask questions and make decisions that truly align with your beliefs and your values. So, why am I talking about this and why is this a really big deal for me? Let me flip my camera here. Just give me a second, figure it out. Take a look. This is Ramsey. Ramsey is my amazing puppy. He is a 6-year-old golden, and many of you have probably seen Ramsey on other videos that I've done. I had an experience that brought this advocacy message to life again, not in a hospital, but actually with Ramsey. He started limping this past summer, and the vet that we consulted was super kind, amazing, caring, wonderful person. Recommended surgery for a probable torn ligament. Before surgery, however, they have a clinic policy that required multiple pokes, and that actually just didn't sit with me very well. As a nurse and a holistic practitioner, that raised some red flags for my thoughts on how the body heals. His body was already under stress from the injury, and adding these different types of pokes, all of them right before the major surgery, just did not feel supportive for his recovery. Instead of reacting emotionally, I took a step back. I went to the research. It's what I've been doing for years. Scholarly veterinary articles about using titers to measure immunity rather than an automatic just giving a poke based on a list. I looked for their insights from vet experts who discuss delaying or tailoring poke schedules, especially when the animal's healing. Then I found another vet who listened, was open to discussion. He looked at Ramsey as an individual, not just a policy checklist of something to get done before surgery. We agreed to focus first on healing and revisit the pokes later. Today, as you can see, he's resting. He just had surgery today. He's recovering and healing beautifully. You can kind of see his little sleeve. He ended up having a total ACL repair, which is pretty intensive. He's actually had some bone cut in the knee. Everything was realigned and he's plated. So it's pretty amazing what they can do for dogs. And the reason we did it is we want him to have great quality of life and be able to actually chase bunnies, because that's what he really likes to do. So how do you advocate with grace? Well, whether you're in a doctor's office or in our case, a vet clinic or even a school meeting, advocacy looks a lot like this. And it's something I really want to remind you that it's not about saying no to authority. It's about saying yes to understanding, research, and individualized care. So what do? Well, number one, you bring someone with you. A second set of ears helps you absorb information and stay grounded. Sometimes emotions can cloud details, and having someone aligned with your beliefs can offer calm support and confidence. Ask open questions, perhaps. Can you explain why this is needed right now? What are the alternatives? Would waiting change the outcome? What are the risks or benefits if we take a different route? Remember, you are not obligated to say yes immediately. It is okay to take time, research, and seek other opinions. Even with the most trusted professionals, informed decision-making means you're part of the process, not a passive recipient. Another thing is surround yourself with aligned professionals. You deserve to work with providers who are going to listen and respect your perspective, as well as collaborate rather than dictate. Alignment brings peace and better outcomes. Advocacy is not new to me. In fact, it's something I practiced for almost 3 decades as a nurse, a leader, and now a holistic practitioner. I am fiercely passionate about empowering people to make informed decisions, guided by both knowledge and intuition. Being an advocate does not mean being defiant. It means being deliberate. Whether it's for yourself, your family, your fur babies, like my Ramsey right here, you have the right and the responsibility to ask, understand, and align your care with your beliefs. Thanks for joining me today. And again, I love looking at my pup. He's finally resting, and I don't know if you can kind of hear in the background. You see the dog on the television up there? It's actually just kind of some just relaxing, great music for healing, and YouTube actually has this. Who would have thought? So he's just calm, relaxed, And if this is resonating with you, just go ahead and share your story in the comments. Next week, we're going to focus on how healing is not linear. And so we'll check in with Ramsey and see how he's doing. Thanks for watching. Bye-bye.